What are eating disorders?
Hi, I'm Amalia.
And I'm Matthew.
So what are eating disorders? People with an eating disorder usually have extremely negative thoughts and feelings about their weight or body shape. And they might say things about themselves like, I'm too fat, even when they're not. They will use food or sometimes extreme exercise as a way to try and control these powerful negative thoughts or feelings.
And they'll either restrict what they eat, usually by eating very little food, which is called anorexia, or they could exercise excessively.
They might eat too much food, which is called binging, or eat food and then throw it up again, which is called bulimia.
A big percentage of people with an eating disorder are women, but recently it's become more and more common for men to have an eating disorder. When you think about it, there's a lot of stuff in the media about how women and men should look or about diets and eating. So there can be lots of pressure to look a certain way or to be thin.
Maybe you've had times when you felt unhappy with how you look or with your weight.
Or maybe you've had times where you felt down about yourself or about stuff that's happening to you. Someone with an eating disorder won't be able to move on easily from these sorts of negative thoughts and feelings. And these thoughts and feelings will be extremely intense. They'll find it hard to stop feeling overwhelmed by their emotions, or to stop the massive feelings of worthlessness and the negative self-talk. And no matter how they look in the mirror, they will likely see themselves as fat or ugly.
Most of the time, we move on from negative thoughts or feelings about our body size or shape and come to feel okay about ourselves. But for someone with an eating disorder, this can go on for months and months. And for some people, years.
And they're not doing this on purpose. In fact, they don't really want to be like this at all. They're not likely to snap out of it either or feel better the next day or even the day after that.
Eating disorders are a mental illness. No one's sure exactly what causes them, but there are things that can help.
So if you're watching this because you're wondering if your parent has an eating disorder, it might be helpful to know what it can look like. Let's start with anorexia. This is where the person restricts what they eat. They might only have tiny meals, which they don't eat much of, or have excuses for why they aren't hungry, so they don't eat at all. They might not eat with the family much, or even stop eating with other people. They might say they're fat or too big when they aren't. And they might become obsessed with diets or exercise a lot. Someone who binges is likely to eat a lot of food in one big hit. This is usually done in private, when no one else is around. They usually do this when they're not necessarily hungry. They may put on a lot of weight and avoid going out or being seen in public. They might obsess about food and feel guilty or shameful whenever they eat. Someone with bulimia might not like eating food with the family, or even stop eating with other people. They'll often binge on food in private, then throw it up, and will usually be very secretive about this. They may not have a lot of social life or go out with friends very much. Like we said before, eating disorders are mental illnesses, but they're not illnesses you can catch. So having a parent with an eating disorder, it does not mean you'll get it too.
If you want to know more about where a mental illness like this comes from, check out the video on this website, What is Mental Illness?
And remember, you didn't cause this. It's not your fault. And it's not your job to make your parent better either. But the good news is that there are things that your parent can choose to do to get help.
Sometimes talking about it helps, or getting support from other adults. Sometimes seeing a doctor, taking medicine, or seeing a psychologist can help people with an eating disorder.
Remember, lots of people with a mental illness do get better and enjoy their family, their friends, and other fun stuff around them. Check out the video on this website, Getting Better, for more information. So this doesn't have to last forever.
Having a parent with an eating disorder, or living with someone who has one, means it's really important that you make sure you look after yourself.
Do things you enjoy and find someone to talk to and have some space.
And check out the video on this website, Looking After You.
Try to find someone to talk over some of your worries with. It could be a parent or a family friend or a trusted adult. Or the kids' helpline, and the number for that one's on the screen. And it doesn't have to be a crisis to call them. They've trained people you can talk to and it's all private.
There's lots of other information you might find helpful on the COPMI website at www.copmi.net.au/youth.
And check out some of the other videos on this website.
Take good care of yourself.